अस्सलाम वालेकुम। उस्मान, आपको मेरी आवाज़ आ रही है?
वालेकुम सलाम जी।
जी,
कैन यू
कैसे हैं
हेयर मी?
उस्मान आप? जी, वी कैन हेयर यू।
अल्हम्दुलिल्लाह, आई एम गुड। हाउ अबाउट यू?
ओके। ओके, सो हाउ इज एवरीथिंग?
एवरीथिंग इज इन गुड।
Okay, perfect.
लेट मी
Okay,
शेयर माय
so
स्क्रीन।
yes, please share your screen. I will just introduce you to all of the participants, and then you are going to start, okay?
श्योर।
Okay, so we welcome you, Dr. Usman, and today the session is about climate and health analytics. So, a little intro from the uh, presenter. So, Dr. Usman Nazir is a postdoctoral data scientist in climate and health analytics at NDOMS, University of Oxford. So, before that, he was serving as an assistant professor and group head at the Center of AI Research from Beacon House National University, and he was also leading the research at the intersection of AI, remote sensing, and environmental sustainability. Currently, he is working in machine learning, computer vision, and remote sensing. And today, we welcome you, Dr. Usman, on the behalf of Department of Computer Engineering, ComStats University, Islamabad. And we are very glad to have you. And because I don't know, some of the participants know it or not, that Dr. Usman was a bachelor student in electrical department, and he is from the class of 2008 to 12. So that's a very pleasure meeting you, Dr. Usman, here. So over to you.
Yeah, thank you very much for the introduction. So, are you able to see my screen and I'm audible?
Yes, Usman, you're audible. So the session will go it like that, that you are going to present it. And after the session, we are going to open for the question answers. Okay.
Okay.
Okay, perfect. Over to you, Dr. Usman.
So, assalamu alaikum and good afternoon, everyone. So, as Umar introduced me, I am Usman. So, today I will walk you through how to measure the disease burden using climate signals. So specifically, I will discuss three diseases, climate sensitive diseases, malaria, acute respiratory infection, and childhood wasting. And then I will discuss the alpha earth embeddings. These are the Google alpha earth embeddings, which encodes the climate signals. And I will use these Google alpha earth embeddings to model the climate sensitive diseases. And how my work, all this talk sits inside Islamic ethical framework. So I will quickly discuss this thing. This may be a different thing for you, and you can have a different opinion on this. But bear with me for a moment. Okay. So I will start my presentation with this triangle diagram. If you see the title, Science, Technology and Environment in Muslim Societies, this STEMS is different term with the STEM curriculum or career. You already heard this term, but this is a different term. So this triangle actually frames everything. And whatever I talk in my following slides will sit somewhere in this loop. So this climate, food and health are separate problems, but a single system. For example, the climate, global warming cuts the food production, and food production contributes to emissions. Similarly, climate change can increase the risk of new disease at some place, and the health system also contributes to emissions. And we already know there is a direct relationship between food and health. So, so in my three case studies, so whatever I will discuss maybe sit somewhere in this loop. So you have to remember this triangle diagram. So as I mentioned this title, why I am focusing on Muslim majority regions, because Muslim are the fastest growing population around 30% of the world by 2050, and 1.5 billion of the current around 2 billion Muslim live in areas in regions which are most affected by heat, as you can see on the right diagram. So that's why I'm focusing on Muslim regions, and I will frame whole this presentation into Islamic ethical framing. So what are the takeaways from my presentation? So these are the questions you by the end of this presentation you can get what is climate telling us. I will use alternative terms: climate change, the climate signal, environmental data, Earth observation data, alpha Earth embeddings. These all terms encode the climate signal. So what these signals are telling us about the disease burden, how we can measure the disease burden using climate signals. The second question is the hard one: how much of the disease burden we can attribute to climate? So we will look into this question. And the third is how can faith actually help in dealing with the climate challenge? So you can have a different view on this because the communities we live with, the Islamic ethical framing is not a decoration, it's a reason the work gets adopted. So a quick Quranic lens on mitigation and adaptation. The first ayah, وَهُوَ الَّذِي جَعَلَكُمْ خَلَائِفَ الْأَرْضِ. So you are the trustee of this earth. You have to protect this earth. So this ayah, this verse relate to mitigation. So mitigation is stopping the problem from getting worse. So I relate this ayah to mitigation, and the second ayah, wala tufsidu fil ardi ba'da islahiha. This ayah relate to adaptation. So adaptation is managing the problem we can't avoid. So I will use these 7 Quranic concepts uh, onto climate action, and I will not go into detail of these concepts, but you will see these Quranic tags in my different case studies. For example, you know about this tag reduce waste is israf, क्योंकि ये टैग हम 5 टाइम जो वज़ू करते हैं तो हमें मतलब हमारी ये रिस्पॉन्सिबिलिटी है कि हम इसराफ ना करें। तो इसके दिस टैग को आई विल यूज इन द emissions in the air pollution which really affecting the acute respiratory infection disease. So I will use these tags as the section tags in different case studies. So let me start with the first case study. So this is our work to date. So I will start with my first case study. So this is the spine of the overall climate health analytics pipeline. I have climate inputs from different sources. I have Earth observation data from different satellites, but it can also include Google Alpha Earth embeddings. They used, I think, 6 to 7 satellites data and encode the climate signal. And I have health outcomes of these climate sensitive 3 disease dataset. And I will train my machine learning model. My input is the climate inputs, Earth observation data, environmental data, Alpha Earth embedding, and I have to my target variable is some health outcome, which can be malaria, acute respiratory infection, or child stunting and wasting. And I will use this climate signal for the inference of some health outcome. So we will see in these 3 case studies. So in study 1, we are actually predicting the malaria outbreaks. So as you can see on the right side, in right figure, I have a geocoded malaria data from 2000 till 2017. So I downloaded this data, sir, from DHS, Demographic Health Surveys. This is a geocoded data set. It's a spatio-temporal data set from 2000 till 2017. And on all these locations, because this data set is already geocoded, I downloaded 44 features. As you can see on the left figure, So I have 44 climate signals or Earth observation data. The I have monthly rainfall, uh, rainfall value. Similarly, I have monthly temperature value on all these locations. So it means I have a climate signal at every spatial location per time step, because I have a spatio-temporal data from 2000 till 2017. So it means I have at each spatial location in whole South Asia, we can have n number of locations. So at each spatial location and at each time step, I have 44 features climate signal data set. So in this data set, we have temperature, rainfall value, vegetation index, distance to water bodies. So it actually encodes my climate signal, this complete 44 feature per location per time step. So this is a spatio-temporal data. I will use this data to predict the malaria outbreak. For the training purpose, I am using from 2000 till 2016 data and then predict on 2017, which is unseen for the model. So these are the key outcomes. In the top left figure, you can see the positive relationship between malaria clusters and the annual rainfall value. So as you can see, where we have more rainfall, we can see the bigger malaria clusters. Similarly, on the right figure, top right figure, we can have a positive relationship between malaria and temperature. In the bottom left figure, we can see where we have more vegetation, we have more malaria, is positive correlation between malaria and vegetation. And the nighttime light, the bottom right figure, in the nighttime light, we are using this nighttime light intensity as a rough proxy toward urbanization. And where we have less nighttime light, it means those are the rural areas. So in rural areas where we have less nighttime light intensity, we can see the bigger malaria clusters. So all the details will be in our Lancet Planetary Health paper, but I will quickly discuss uh, our model in a following slide. So we also evaluated our pipeline, which is MLSTM, on a different continent with different epidemiology. For example, this is a Africa continent, and we are evaluating our pipeline first on South Asia, then on Nigeria. So as you can see in the Nigeria, we have similar kind of correlation with the vegetation. We have a positive correlation in the middle figure, which is a distance to water bodies. We can see where we have near to the water bodies, we have more malaria clusters. Similarly, we have a positive correlation with the temperature, as you can see on the top right figure. In the bottom right figure, we can see the nighttime light intensity, and you can see the nighttime light intensity uh, cluster. These purple clusters showing the intensity of nighttime light. And here we do use a different visualization as compared to the heat map in the previous slide. You can see the dots. The red dots actually encodes where we have higher malaria incidence rate. So uh, these clusters where we have higher nighttime light intensity are the urban regions, and we can see the green dots mostly are in those regions where we have higher nighttime light intensity, and the red dots are mostly out of this. This specifically denotes the rural regions where we have more malaria clusters in the rural areas or the outskirts of that specific urban regions. So this malaria um, m- prediction modeling, we use the MLSTM pipeline, and you can see in the right figure, we have a spatial strong association between the actual malaria incidence rate and the predicted malaria incidence rate using our LSTM model. And the details of this complete architecture will be in our two papers. First is on South Asia and the second is on Nigeria, Africa. So we developed this data-driven framework to predict malaria outbreaks in Asia and Africa, and currently we are evaluating on all the African countries, which around 45 African countries and also on all the South Asian countries which are around, because the DHS data set is currently available from 2000 till 2024. So this pipeline is evaluated from 2000 till 2017. Now the DHS data is updated and we have complete data set till today from 2000 till 2025, I think so. And we also have the climate signals from 2000 till 2025 because we are evaluating um, the climate signals to predict the malaria outbreak prediction. So we have a integrated multi-modal Earth observation data, which includes environmental, geospatial, and urbanization. And in our new journal article, we are also using some socioeconomic indicators alongside with climate indicators and also demographic indicators. So that will be a more comprehensive approach to to actually predict the different disease outbreak using all the indicators. So as you can see on the right figure, we have a strong spatial agreements which between actual malaria incidents and predicted malaria incidents. This is a bivariate map, and you can understand this map because the higher blue color shows we have a high, if we have a high actual malaria and we have a high predicted malaria, then we have this notation, this blue color. And as you can see, you can understand this bivariate map. I will share my slides with Omar. And currently, our future work also explore additional environmental covariates and alternative models. For example, we are currently working on transformer-based some architectures, deep learning architectures. So this is my case study one, and I use the Quranic um, tag, which is a Khalifa, because we are the trustee of this land and health, and we can model the early warning system to predict the malaria outbreaks based on these climatic signals or the embedding dataset, which is publicly freely available. So in my case study two, I will discuss acute respiratory infection. So here I'm using the Quranic tag Israf because this acute respiratory infection is due to the air pollution as a wasteful excess. So I'm using these emission sources, for example, the factory chimneys and brick kilns, because they emit different pollutant. For example, the gaseous indicators, for example, carbon dioxide, nitrogen dioxide, sulfur dioxide. So I am specifically first detect these emission sources in whole South Asia, because this ARI, acute respiratory infection dataset, is available for all DHS countries. From the DHS, you already know, the students from medical background or bioinformatics may know the demographic health survey data is available globally. So similarly, for the malaria dataset, we have a global coverage for all the African, South Asian, all the DHS countries. Similarly, we also have this ARI, acute respiratory infection data for the children. So this dataset is the acute respiratory infection cases per DHS cluster. So it means this is a geocoded data and we have global coverage. So where we want to see the correlation between emission sources, the factory chimneys, and specifically I am looking into the detection of brick kilns in Togebate in South Asia. So why I am looking specifically on emission share, emission sources, because according to the CM Punjab Smoke Mitigation Plan 2024, during the smoke period, we have a 15% increase in asthma cases among school children, and we have a 500 people were hospitalized in a single day in government hospitals of Lahore. And if you see the emission share of only the Punjab province in Pakistan, it's around 95,000 kilotons per year of the greenhouse gases emissions. And from this emission share, the carbon dioxide only have 90,000 kilotons per year from from this emission share, and you can see the emission share of all other gaseous indicators. So these are the gaseous pollutants which are released from the factory chimneys, specifically briquelants, which have around 24% of this emission share. So I am specifically looking into the correlation of these factory chimneys, specifically the briquelants in the briquelant belt of South Asia, and correlate with the acute respiratory infection, because I am using these gaseous indicators to predict the acute respiratory infection cases on in specific regions. So this is this is the main challenge to detect the factory chimneys from the aerial imagery, from satellite imagery, and we have a huge variation in satellite imagery. If we have to detect all the factory chimneys in whole South Asia, starting from Afghanistan, Pakistan, India, Nepal, Bangladesh. So these are the 5 countries on which we are doing this analysis. And in Afghanistan, the first image you can see the barren land is totally confused with the brick kiln. In the middle figure, we have a oval shaped brick kiln in Pakistan. In India, we have a round shaped brick kiln in some parts of India. And in Nepal, you can see the brick kiln surrounding is totally different. In some parts of the Nepal, the brick kiln is surrounded by vegetation. In some parts, it's surrounded by some society. So we can see there is a huge variation in the satellite imagery. And the existing strategies, for example, the recent Punjab brick kiln census survey dataset actually detect the brick kilns in the Punjab using manual surveys and field surveys, which are both tedious and lack scalability. So we are actually using this kind of pipeline. On the left side of the figure, you can see the classical machine learning pipeline. If you have to detect some object from the satellite imagery or aerial imagery, you you download the high resolution satellite imagery, and you slice that high resolution into some image patches and pass each image patch to some classical or deep learning neural network to classify, and you can also locate the possible locations. Because when you download the high resolution imagery, actually each image tag is some x tile y tile, and you can convert that x tile y tile to associated latitude longitude location. So after classifying, you can actually also find or locate the possible briquelants. So in our proposed architecture, we are using sequential transformer chaining method, in which from the high resolution imagery, we are using combination of high resolution and low resolution. For our low resolution imagery, we define a new chimney index to detect the factory chimneys and briquelants in whole South Asia. And using a high resolution imagery, we are actually first um, using a first transformer, we are only getting the regions, the factory areas. We are filtering the factory areas from whole South Asian imagery. And then after getting the factory areas, we are detecting the factory chimney, and specifically in this case, the brick kilns. And after detecting the chimneys from both high resolution and low resolution, we use a integration approach to to find all the brick kiln locations in whole South Asian brick kiln belt. So in this belt, we then download, because we have all the locations of the brick kilns. So because we have to get some gaseous indicators or the climate signal to model acute respiratory infection. So then we use Sentinel-2 and Sentinel-5P to download the different climate signal and different gaseous indicators, so that we can use that climate signal to model our acute respiratory infection cases. So in the qualitative result, you can see there is a strong spatial association between the locations of the briquelants and the acute respiratory infection cases. This dataset is geocoded from, I downloaded from DHS, and you can see that in the heat map, there is a strong spatial association between the location of the briquelants, which we detected in whole South Asian briquelant belt, and and the acute respiratory infection cases. It's this result is specifically for children under 5. So the quantitative analysis of and the correlation analysis of different gases indicators to predict the malaria outbreak can be found from the following articles. So I'm going toward my case study 3, which is a heat exposure versus child wasting. As you can see, uh, the child wasting, I am using this outcome target variable, which is a WHZ, weight for height Z score. It defines how far a child's weight deviate from the WHO median weight. And for a healthy children of the same height and gender, it's actually it's due to the malnutrition or the food security problem related to that triangle, which I start my slides from, that the climate change actually cuts the food production in some areas due to the global warming problem. So similarly, you can see the relationship on the x-axis we have a daily mean temperature value, and on the y-axis we have a mortality rate. So in areas where we have a higher warming conditions, we have a higher mortality rate. It increases exponentially. So this data set is also for 41 DHS countries. As you can see on the right choropleth figure, you can see the countries where we have a Tmax, the temperature maximum temperature value, where we have a higher warming conditions, we have a negative WHZ score. And you can see in the bottom right, the label, the negative WHZ score actually shows a child's, actually the WHZ is lighter than the WHO standard, and if the WHZ score is less than -2, it's a moderate wasting, and if it's less than -3, it's a severe acute malnutrition problem into those children. So in the left figure, you can clearly see, because in the choropleth map, you can stop that maybe video or GIF, and then you can clearly see where we have a high temperature value, we have a negative WHZ score. So there is a strong association between that heat and the WHZ score, which is a child wasting problem. So now I will use, because currently what I am doing, I am downloading the climate signal, the earth observation variables, the different environmental data using different satellites and different sources. So instead of downloading manually from different sources all the climate signals, for example, you want to download the gases indicators or the surface temperature value or different vegetation index, rainfall, precipitation, these are all climate signal and earth observation variables. So instead of downloading all the variables, why not I use the currently foundation models embedding datasets, because this is a Google Alpha Earth embedding dataset. This encode all the climate variables. Maybe it also encodes some other variables, for example, demographic variables, socioeconomic variables. So this is a multi-modal Earth observation dataset. They used, I think they stack around 5 to 6 satellites, and using self-supervised machine learning approach, they produced a 64-dimensional embedding dataset. And this dataset is 10 meter by 10 meter. Its spatial resolution is 10 meter pixel, 10 by 10 meter pixel, and we use this data set as input to the model to predict some disease. For example, our disease data set is geocoded on those specific locations. We can also download the Google Alpha Earth or any embedding dataset, because nowadays there are so many embedding dataset. This is a Alpha Earth, some embedding other datasets. Maybe you heard this name, Meta Earth. Uh, there are many names which are actually including different Earth observation sets to produce these embeddings. So this is a Google Alpha Earth slide I took from DeepMind. So this slide is showing how they are actually producing this data set. This is an annual embedding data set. They use, I think, around 8 satellites. So different from different satellites, they used some foundation model, self-supervised machine learning technique to produce this embedding image, as you can see here. So you can also see this image actually encodes different weather conditions, different it capturing different optical observations and also lidar observation. So it encodes all the climatic conditions and earth observation variables. And if I show you in this embedding axis, so in this embedding axis you can see for each location is some place in whole globe. So this specifically place, or you can see this pixel, is a 64 dimensional vector, and you can see this vector value in a 64. So this vector of 64 different values actually encode some climate signal. So the climate signal, it as you can see in the previous slide, so these are these are different climatic indicators. So I use this climate signal of 64 different values instead of manually downloading my different climatic indicators. So I then use this alpha earth embedding with my baseline indicators. And I also use how the embeddings using alpha earth embedding versus my baseline results. And here for the malaria case study, I evaluated this approach on Nigeria and India, and you can see there is an increment in R square score and decrement in root mean square error using this alpha earth embeddings. And similarly for my second case, which is acute respiratory infection, I also have increment in my R square score and decrement in root mean square error. And you can clearly see from this choropleth map, and as the green signal actually telling is that the alpha earth embedding reduces error. And similarly here you can see the green signal is telling us where the alpha earth embedding is helping, because if you have a less delta or scare, it means you are near to, our actual value is near to the predicted value. And similarly for my case study 3, which is a heat versus WHG score with a childhood stunting problem. So here the alpha earth embedding is actually helping in in the increment of R square score and decreasing the root mean square error. So it means this alpha earth embedding or any foundation embedding dataset, if it encodes all the climate signals, you can, instead of manually downloading all the climate or earth observation variables, you can just use this alpha earth embedding dataset. You can access this using Google Earth Engine, or it's also from directly from DeepMind. If you want to implement machine learning or deep learning architecture on your local PC, you can also download all this embedding dataset. And I downloaded this embedding dataset on all the locations of different disease, because I have a disease dataset for all the DHS countries, which are around 41 different countries for all these three problems. And I evaluated on all the countries, and you can see clearly from this choropleth map, or it's more visible in the radar plot, because in a radar plot you can see. So we submitted this our evaluation in a recent article, which is a visualizing climate in 2026, and it's submitted. We will be notified with some hopefully acceptance in by the end of this June. Then I will share this article. So if I summarize what I am telling you, we have actually different layers of dataset. So we have a currently we have a climate earth observation dataset, which I am getting from different sources. And after these foundation models, we have the embedding dataset of the whole globe. So We have this embedding data set which encodes the demographic data, climate data, and Earth observation data. And these three layers can be actually covered by any embedding data set. And I have the health data from the DHS. So it means I have these two layers, the embedding dataset layer and the health data. And I can actually use different embedding dataset which encodes climate signals to predict the malaria outbreaks in different conditions. So if I quickly show you this example here, I use 5 satellites uh, using this Google Alpha Earth embedding approach. I use 5 satellites to actually map this flood in whole South Asia toward East Asia, including some East Asia countries in 2025. This is a flood I mapped, and then I use different layers from some other sources. For example, you want to see the affected population, you want to see the affected schools, you want to detect the affected hospitals, affected crops. So there are multiple layers from other sources. Instead of, you can actually relate the climate. So I'm using these 6 satellites. Using these 6 satellites and using some majority voting approach, I detected this flood pixels in South Asia, including East Asia. So here I'm actually looking at the school locations and I want to find the affected schools using this flood map, because I'm telling you how you can integrate different layers to find different things. So first I was looking into climate versus health outcomes. Now I'm looking at different affected infrastructure and affected population and children. So I have the school locations dataset which is available freely, publicly available on OCA and HOTOSM website. I downloaded this dataset. I find the flood map using 6 satellites approach using majority voting. And I then take an intersection of these two layers and find all the affected schools. In this dashboard, we also implemented some GPT, and we also give our data set to GPT, and tells us where we have more affected schools as compared to the in whole South Asia. So it's telling us that in the southern, I think India, we have more affected schools. Similarly, then I downloaded, this is a flood map I calculated in whole South Asia. Then I calculated the affected children actually. So the children dataset I downloaded from World Pop website. So we have a children layer, all the population layer available on World Pop. So I'm specifically looking at children, and you can see in the flood map, I'm only showing the South India part because this dashboard takes so much time to produce this visualization. So I'm just using the South India map actually to show you just. So this is the affected schools using this flood map. Similarly, I'm using health facilities from the HOTOSM website. I downloaded that dataset and I used my approach for the flood mapping to for the typhoon tracking in Philippines, and I'm looking at the affected children and the affected hospital facility. So it means you can download this dataset from different sources, because in the embedding dataset you can have demographic, climate, and earth observation conditions. But if you want to detect some other infrastructure and other population variables, you can have some different sources. For example, World Pop, Oka, HotSM. So instead of embedding, you can use these layers to find the affected infrastructure, including schools, hospitals, affected children, affected population. So in this that Bosho, obviously I am telling you that we integrated GPT, and it's also telling us some, by looking into our dataset, it produces some analysis. So this is the acute respiratory infection. So we already covered this. I have a dataset for the whole globe for all the DHS countries. So I am mapping my brick kilns into this heat map. And then I ask my GPT that where we have more affected the acute respiratory infection cases, because this dataset is already geocoded and it's telling us where we have more brick kiln density, we have a more affected acute respiratory infection patients cases. Similarly, we developed this Cyclone Data Hub. Uh, I think it's this Cyclone Data Hub analytics website. So you can actually explore this website, Cyclone Data Hub, and you can see we have a, I think, around 60 countries data, and you can see the malaria versus Earth observation variables. You can actually play with these different heat maps, and you can also see the acute respiratory infection health data versus different gases indicators. So this is not fully developed dashboard, but you can actually access this website. I hope so that it's working. It's a Cyclone Data Hub. Yeah, I think it's a cyclone-datahub.org. So I will share this maybe website after this with this presentation. So from all these three case studies, four case studies, the embedding using embedding dataset, we can actually implement some early warning systems, because if we use some embedding dataset and we have a ground data available, because I'm using not the ground data, only the DHS data. So you can also use some ground information, and you can produce some early warning system for Pakistan. For example, you can also use the DHS data, which is freely publicly available, and you can produce some pipelines for the prediction of some outbreaks, different disease outbreaks, and you can also implement nowadays, because due to the GPT and some foundation model approach, you can implement a dashboard and the integrate in the GPT into your dashboard to actually relate different embedding dataset with different disease forecasts. So in the embedding dataset, I'm already telling you that it encodes only climate signals. It does not include health data. But the recent Google Earth AI and different Meta companies are working into some producing some embedding data which also encode health variables. So another approach can be we can maintain national alpha style feature catalog actually for specifically for Pakistan, which can encode climate variables, health data, agriculture data, water, so on, because we have because this data set is produced from multiple sources. Similarly, you can see the DeepMind, Google AlphaEarth embedding, how they produce this dataset. I use a similar approach to produce my flood map, because they are using 8 satellites. I use 6 satellites to produce to detect my flood detection approach, flood pixel detection approach using supervised uh, weak labels. So we can also maybe make some national Alpha Earth style feature catalog, which also encodes the climate signals and the health signals. If we have some health ground data available at district level, provincial level, or maybe if it's a geocoded level, so that is a better embedding dataset as compared to using we are using just Google Alpha Earth embedding, which actually they trained their model mostly on the Europe or the other African countries, or but I'm using that dataset and it really helping me to evaluate my mm, all the pipelines for the prediction of different disease outbreaks. And I think that's all why it's stuck. So that's all from my side. Thank you so much.
Thank you, Dr. Usman Nazir, for a very interesting talk. And let's see if we have any questions from the audience. So, audience, you can raise your hand so that I can allow you to ask questions, please.